Good evening. Hi, Crystal.
Hi.
Hi, everybody. This is Dr. Maria Sophocles, and welcome back for another episode of Gynecology, where we discuss women's health issues, both at a macro and a micro level. Sometimes we just discuss specific GYN diagnoses. Sometimes we discuss broader issues like health discrepancies based on gender or race discrepancies in healthcare. Um, Tonight, we're talking about something that's all over the news anyway, but we think it needs more airtime. And this has to do with the recent leak of a draft of the U.S. Supreme Court's feelings about the Roe v. Wade decision and the what seems to be imminent um, overturning of Roe v. Wade. And as a board certified OBGYN for the last 27 years, I've grown up with Roe being a law that I felt was going to be in the books forever. So this is shocking and disturbing to me. My guest tonight, I'm so lucky to have Crystal Lander, who is from Pathfinder International. She's the Chief Strategic Engagement Officer. Ooh, I don't know if I could say that quickly for Pathfinder. Pathfinder, and I'd love her to tell us a bit about it. My understanding is that it's a global health organization, which is locally led and community driven programs that support women to make their own reproductive health decisions. That's a mouthful. I'd love Crystal to put that in real terms so I can understand what Pathfinder's mission is, what your role is in that, and then we can get to some serious talking about what's going on today.
Absolutely. And thank you for having me. I am truly honored to be a part of this conversation. I think I've been having it with friends and colleagues, and you feel frustrated and excited and about what we can do all at the same time. So Pathfinder International works around the world. We were founded in Watertown, Massachusetts. And so one of the things we're based here in the US, but operate in 15 countries around the world. And what we've always done is been a part of this great leadership of organizations that are led by local nationals in country who said we want to improve our healthcare the same way women in the United States have access to healthcare, reproductive healthcare. So the irony of this week was not lost on us. And so you have, countries where we've been working like Mozambique that's improved their reproductive health and safe abortion laws and increased access and quality. So that's another most key piece of all of this, quality and access across multiple countries. And so Pathfinder works on advocacy. We also work with youth and adolescents. A lot of people think of youth as just young people running around, but that's married youth. Those are first-time parents. We work with those because many times they get married very young and have no idea what safe motherhood looks like. And so, or a marriage that has strong reproductive health knowledge for both sides included. So we found working with providers against provider bias in many countries, as well as working with first-time parents was a key piece of the real world of reproductive health. So we are really a part of the larger reproductive health space. We're advocates. We are champions. We work with governments in countries where we work to, strengthen their laws related to health, but also to work with local, national, civil society organizations to ensure that all the work that we do is continuous. And we've been doing this for almost 65 years this year. And so we're really excited that when the communities where we work, everyone is a part of the community. That's what they do. And we just support that work from some, supportive tasks from the U.S.
So it's clearly global, but how this seems overwhelming to me. How do you decide how much time and energy to spend on policy versus grassroots organizations versus do you go into classrooms even or into local clinics? Help me understand how you connect with women directly.
Absolutely. I think one of the first things we do is all countries are different, right? So you really have to look at what that country need is. And so in a country like Burkina Faso in West Africa, French speaking, we're working directly with government and the Minister of Health, and we have for probably about 8 years now. And I love that they have one universal health plan, and that no matter what minister of health comes into play, they said, you know what, we're committed to strengthening access to services in a country. So at this case, we're working with the government who said, this is what we want to do. And we work with them in helping them to say, here are the right partners here, and here's where we can guide and support. Now, in that country, it may be with fiduciary support and access to that operations part. And then in a country like Kenya, which is on the other side in East Africa, which is very different, it has a lot more internal systems that work and are safe and make sense. We're working with the government there to actually get out so that healthcare is right in the communities where people live. And again, that's something that we take for granted in the United States. You know, you see primary healthcare clinics on every corner. You can see an emergency room. We almost just take for granted those things are always there. Well, in other countries, that may not be true. And so what people look to the United States for is says, hey, you all set up a system. We know it's not perfect, but where healthcare is right in the neighborhoods where people live. So if I need to go to urgent care, I go right there and I get to see someone. If you look in other countries, that may be true in some of the main cities, but probably is not true when you get outside of the major cities.
So I'm going to say 2 words, and that's and yet. And yet, Crystal, and yet we're in this amazing country with so much money. We spend more money on healthcare than any other country in the world, I believe.
Yes.
And yet we are still sort of 50 different countries, and we are divided. There's polarization, there's political polarization. We know that. Mm-hmm. We don't have a healthcare system that fits all. It's pretty broken. And more importantly, we are really divided on our healthcare policy, on the availability of contraception. In certain, some religious groups feel differently, some community groups, some businesses feel differently. Mm-hmm. We've heard about, we know about different businesses that feel one way or the other. So how, I guess what I'm really asking is, mm-hmm. what, in your opinion, are some of the biggest ramifications of the possible loss of Roe v. Wade in terms of access to women's contraception? Because it seems like they could be 2 different topics, right? Abortion and contraception, but they're clearly intertwined. And we know we already have a society that has differences of opinion about contraception. And should people, I have patients even today, their mothers come in and say, I don't want her to have contraception. She's going to run right out and have sex. And studies show that that's not true. That if you provide contraception to young women, you're giving them the ability to have agency over when they have a family. You're not urging them to have sex. This country has a very bizarre, almost paradoxical relationship, in my opinion, with sex itself.
Absolutely. I agree with you 100%.
I feel like it all distills down to that. And we're not sure if we're a society of twerkers or we're a society of Puritans. I'm not sure, or we're both. But how do you feel that this bombshell news, how will that affect how Pathfinder and other organizations will this make struggles for you all in terms of access to contraception? I mean, is that something you're involved with, right?
Yeah, absolutely. And I think you hit the nail on the head when you said abortion and contraception are 2 different things, but they're intertwined. And so in this country, we make them a political ball. And some people will say, well, I don't believe in abortion, but I believe in contraception. And what we're trying to explain to them is they are combining them in efforts so that you don't have access to either. And that's what I think people are just missing. I'm like, hey, the same laws that are peeling back Roe will be the same ones they use for contraception, or determine who gets contraception and what communities they get them in. And to say we want this to be a state's issue is ridiculous. So 50 states, you mentioned it, 50 states all doing their own thing, we know doesn't work. We don't do that. We need centralized voting systems. We need these. We are a United States of America, and there are some things that should be at the top, and women's agencies over their body should be there. Like, I never see a law against men's bodies.
Politics,
exactly.
I know. I think we're speaking the same language. I'll tell you a story quickly today. Today I was fortunate enough to be asked to go testify at the state legislature to try to get Bill S-572 passed. This is a bill I testified 3 years ago today trying to get this bill passed. This is a bill that nobody should have any reason not to pass. It allows contraception to be sold. If you go to a clinician and you're deemed, that can be a nurse practitioner or a doctor, and they say, you, Crystal, you're healthy enough to have birth control pills. You have no contraindications. They give you the prescription. You then, in 1 year, can go to your pharmacist who can pull up your electronic health record, see that you have no allergies, no contraindications, ask you to sign a form saying nothing changed, you didn't develop liver cancer or anything like that, and then give you a year's supply of contraception without having to go to a clinician. This is already
Pretty
done.
basic.
What?
I said it's pretty basic.
Pretty basic.
Like, who's against
20
this?
states have already passed this. Okay. And I gave my spiel. I did my best, and they said 7-0. They passed it. Great. Okay, that makes sense. As I was walking away, one of the senators said, I think maybe we should have an amendment. I don't think we want young women to be able to get contraception, only older women. He said, I'm thinking of my daughter, and she's 18. 17. I said, I don't want her being able to go get contraception. And I thought, what are you saying? How old do you think people have to be to have sex? I mean, and I thought, he's so far removed from the women who need this bill. They're not the women who have health care and who, who can get driven by mommy to the doctor. They're the women who have to take a day off work to get to a doctor. And in New Jersey, the number one reason for unintended pregnancy is women who could not afford bus or cab fare to the clinic.
I could see that.
Unbelievable, right?
Unbelievable.
In New Jersey, 53% of pregnancies are unintended. 53%. So these people that think abortions are just women who are lazy and casual, and
they had a bunch of one-night stands.
Yeah, a bunch of one-night stands.
It's a punishment. They want to punish people, and it's women in particular. Men never come up in the conversation, by the way. No one ever says any responsibility.
I wonder who we're having sex with. I wonder how we're getting pregnant.
How we're getting pregnant.
The Immaculate Conception. But if 53% of pregnancies in New Jersey are unintended, Crystal, that means a large part, and I think there's a study that says somewhere around 67% of those pregnancies, the women wanted birth control but couldn't get it. So these are not women who are being lazy or casual. These are women who can't get there. They can't afford a copay. They can't afford to take a day off.
Another visit.
They can't afford a babysitter. And they have 3 kids, and they can't afford a 4th. So
I think that's the thing that people forget, is that many times, women are saying, you know what, I may want to have a child, not right now. I want to delay pregnancy. When you have the first child, you want to wait for the second child. Natural breastfeeding doesn't work for everyone to delay pregnancy for the second child. Many times it doesn't work. So now people are saying, wait, I didn't plan to have 2 children under the age of 2 while I'm still nursing 1. I would like to wait, delaying the second pregnancy. And it's staggering to me that it feels very much like I want to punish women for them getting pregnant, and they should be responsible. And then the cavalier, I think what shocked me by the leak was the cavalier idea of, well, this is not a problem. Everyone can just go and adopt a baby. Just give them up for adoption. As if that is a cavalier thing that people can just do, one on either side. And there's just, I actually started the process for adoption. And one, I found it ridiculously expensive, by the way. And then 2 is it's very time consuming. And so I think people have this idea that adoption is just, hey, I'm ready to adopt. Let me just go find a kid. It doesn't work that way. And what happens to all the children in the system who are not adopted, who are waiting for someone to adopt them? It's very frustrating, because it seems like we spend a lot of time focusing on embryos inside of a woman's body and not focused on, the children once they come out. Because once they come out, everyone's like, well, that's your kid. You had them. That's the first thing they say.
Right. And also from the other side, if I'm pregnant and Amy Coney Barrett wants me just to just give the child up for adoption. I know she's had children, but it's hard to believe she's had children, because having had 4 of my own, I can tell you,
Doesn't
there's
work.
no woman on the planet that is not emotionally connected with something growing in her body for 9 months. You can't tell me anybody has zero feeling.
Unless there's a mental illness, which we know that happens, is rare. The reality is just what you said. Women do not give up for adoption, children for adoption, without a lot of painful decisions on that, and many times maybe without their choice involved.
And speaking of pain, I mean, abortion itself carries with it so much pain, so much shame.
Yeah.
I have women that come to me seeking abortions who are racked by their decision, often because of pressure from a second cousin who's pro-life, or someone who's not going to be faced with financially raising that baby or anything like that. And I think, I don't know, I know you and I could go on for hours probably, and we could go in 100 directions. But I think that, I think the most important thing I want you to share with everyone today is what you said to me earlier about, in terms of the ramifications
Yeah.
globally for this, because we all know the ramifications nationally are going to be disproportionately on minorities, on women who are falling under the radar because they're minorities or because they're in poverty. And these are people who need a leg up, not a leg down. And
Absolutely.
that's not anything new. I'm not, there's no earth shattering news there. But what many of us fail to realize in America, or fail to think about with something like Roe, is the global
Yeah.
ramifications. So
Yeah.
you were so articulate. Would you share that with me again?
Absolutely. And this has been a great conversation. But one of the things, Pathfinder, we were, I think, really shocked as colleagues, was what is the impact going to be on the rest of the world? Because we're proud that the United States is the largest global health donor in the world. We believe that it's important to support other health systems around the world. The United States, is a champion for human rights. The United States sticks up for, countries in need, people in need around the world. We know that. We are a very giving country. We're not perfect, but we're very giving, and we have to own that, and we love that. But when the United States is on the wrong side of an important issue like women's human rights, it makes other countries think, oh, so they don't think that this is that important. Literally, we're in the last 30 years, only 3 countries have reduced access to abortion in the world. The United States will be one of them if Roe's overturned. That's crazy. Countries like Ireland, Argentina, Mozambique Mexico have actually increased access for abortion for women in their countries, and we literally are going the other direction. There's no excuse for it. The reality is our principles are women's rights are human rights. We said that that's what we believe in. Women should be able to make decisions about their bodies, and we believe that's a universal principle. We believe that the United States, it has a more moral high ground to speak on these issues and be that way. But if we overturn Roe, we won't have that anymore. And that is really disappointing. And that scares me about what standards we're setting for the rest of the world, to be perfectly honest.
Me too. But I'm hopeful that the rest of the world will take comfort in seeing countries like Argentina and Mozambique and Ireland and say, well, not sure what's going on in the US right now, but if Ireland, if Argentina, if these
Yeah.
Catholic
Catholic
strongholds
countries.
can look past, can separate church and state and say women's rights are human rights, and, you know, a women's right to plan her family it goes above and beyond someone's political career, that maybe other countries can do that. I'm hopeful that they'll take cues
That
from.
is my hope too. Honestly, that is my hope, and that frankly it gives me motivation to continue. I am excited that people are paying attention. People are understanding that the vulnerability of women that you mentioned earlier, women of color, poor women, women, gender nonconforming, all of these things
Yeah.
are women who are most vulnerable. But something we saw pre-Roe is those predators who set up around, and they realize when you are vulnerable, you are very vulnerable to other people trying to take advantage of you. And that scares. That's the back alley abortions that everyone used to talk about, and our generation did not see because of Roe. We don't
Mhm.
want women being vulnerable to these predators who are going to say, well, I can help you out here, in these states where they literally are going to wipe it off immediately if Roe is overturned. I mean, I'm
It's
lucky that I live in a state that, has more protections, but it
sure,
is scary because
sure.
I do look, we know what's going to happen. This is not like
Well, the
something
abortions are gonna happen. There's
always.
not a question. So,
Yep.
I was lucky enough to speak to one of my colleagues the other day who worked in New York City before Roe, and
Oh.
he was telling me what it was like, and I can't believe how naive I was. He said, Alex, can I have a plug, please? It's about to die. He said to me that in the New York City hospital where he worked, they kept 2 operating rooms empty and reserved for treating back alley abortion septic women. And I said, oh, do you see like one a month, one a week? He said, oh no, every day,
Yeah.
all day long,
Yeah.
every
Yeah.
day, all day long. So, I mean, we don't want to go back to that. That's medieval.
Yeah.
And I've taken care of those women too. And I'll tell you, I mean, to see someone die, in any situation is horrible, but to see them die from something that's not
Yeah.
necessary is really horrible,
Those
really horrible.
preventable deaths.
We do have medical abortion. And I want to make sure our readers
Yes.
understand that. I have a lot of women who actually don't know what that is. So, to terminate a pregnancy, it can be done surgically. This is not partial birth abortion. That's not a real medical
Thing.
term, by the way.
No.
There is no such
That
thing
was
as
that was, what was it, revisionist history,
yes.
alternative facts. That was alternative facts that people kept
Yes, that's a
repeating.
horrific term that
Yeah.
implies some little preschooler is being born and
Yeah.
something like that. 95% of all terminations are in the first trimester.
Yeah.
They're done either surgically or through medication. Surgical abortion is done by an OBGYN by inserting a hollow tube about the size of a pen in through the cervix into the uterus, connect it to suction, the contents of the uterus are expelled. That's the end of it. A medical abortion is 2 pills, one taken, which stops the pregnancy, then 4 pills dissolved in the cheek 24 to 48 hours later, which cause the uterus to cramp and to expel the contents. Sometimes everything doesn't get expelled, and that person requires a surgical intervention anyway. But if done early, they're in general safe and effective. I think that medical abortion, now that surgical abortion will be so much harder to get because clinics are being watched, bombed, threatened. I have
Harassed.
harassed.
I mean, the anti-choice movement has already said the communication strategy now is to go to those states and try to convince women not to have abortions. So their
Exactly.
goal is to harass women. It's
So
really
I
interesting.
think that we will see the rise of
Mhm.
medical abortions
Now,
popularity.
some states have already outlawed it, like South Dakota.
I know, I
Yeah.
know, I know, but I think states where you can get it, I
Yeah.
think what people will do is, I'll say, "Hey, Crystal, it's Maria.
Yep.
Do you
Yep.
I have a patient in North Carolina. It's outlawed.
Yep.
Do you know anyone at
Yep.
whatever?" And we'll all have to have this underground network to be able to help women so that they're not endangering themselves.
Could you
Um,
believe we would be here at this time
you know,
and creating underground networks for abortion services? This is stuff that was done in the 60s, where like you would, drop off someone in state lines and they would bring them to New York to have an abortion. It's really kind of shocking that
yeah.
we are going literally back in time.
So I think it might be we'll stay local and we'll mention the Yellowhammer Fund,
Yeah.
which is a
Awesome.
501c3 abortion fund, and it's an organization for reproductive justice. And importantly, it serves Alabama, Mississippi, and the Deep South. And
Where
I
they
think
need it.
women in those states have the same issues that women do here where I am in New Jersey, and they need the help. So please, you can go to that if you have interest in serving or in contributing or in just
Awesome.
learning and understanding. I'd love to hear more, Crystal, if you have
Yeah.
any other thoughts about um, sort of abortion in a post-Roe world or contraception in a post-Roe world, and what your thoughts or ideas are for that, or what Pathfinder's thoughts are.
Yeah, I think we after staff kind of got over the initial shock of some of the reading the into the language of different things, one of the things we instantly thought about is, okay, one is the ripple effect to other countries. We do think that a number of countries will say, we're going to step up even more, many of the European nations, to say, we're going to help women. You have donors, you have companies who are standing up and saying, no, this is not right. We don't believe in this, and we will ensure that we will pay for safe abortions and transportation for anyone who needs it, anyone who works at our companies, especially those larger companies. That's really important. But one of the things that does worry me is these women who are not a part of a big company. They don't have necessarily a formal sector. They have, private, informal sector jobs. These are just women not a part of the system. And I worked at Planned Parenthood in the beginning of my career, and I will tell you that it shocked me because as a college student, you may go to Planned Parenthood. It's pretty nice and fancy, and one person's there, another college student. But then I was working at this clinic where women would come in, multiple children. They may have a grandma with them or someone, and they literally were like, I can't afford. We cannot afford another child. And they were making a decision for their family. You would have husbands and wives coming together, and it was cheaper and easier for contraception for the woman than it was for a vasectomy for the man. And I think that's the other thing is, why is that true? Why is it, the woman has to take on the burden, but then you're going to take it away from her. And it's because it was just simple control. So you have these families coming in, and they were saying, we have 3 children, usually all pretty close in age. We need to stop. We just need to stop. And so they would be on, many times they liked injectables. They would do that. They would come back, but they liked injectables because they didn't have to come back all the time. And the most we could give them is 3 packs of pills at a time. And so the idea was that, wow, I can't get more than that. The first time you had to come back after 1 month, it just made it really difficult. And I think about the cost. I don't think people really think, you said you had 4 children. Before I had my first child, I had no idea your last month, month of pregnancy, you had to come every week. Right. It's a privilege to be able to go and leave work and go to a doctor or come in late every single day, for your last couple weeks of your pregnancy. And these are just the little things that I don't think people think about, is that the cost of pregnancy is just not the child. It's the healthcare, it's the process. And luckily I work for an incredible organization who's supportive of these things. But if you're working many times people are working in service industries, they didn't work, they didn't get paid. So a lot of visits were skipped, and a lot of, postnatal visits were skipped because they had to get back to work.
Yes, exactly.
So those are the costs that I worry about in general. And we would have a woman from WIC come in, Women, Infant, and Child, to come in and try to do everything at one time. So that one visit in the room, they would hit different people. They would talk about benefits. Is your child already signed up for the CHIP program and all that? Because they knew that they may not see that woman again for a couple more months. And so I applauded my colleagues who worked all in the area, who would come in and help, and even giving them all a card and saying, we don't care about your immigration status. What we want is to make sure that you have a record of your pregnancy. And I just was proud to work in a place where the whole community cared about what was happening. And these were just people from Latin America, which is also the fallacy of living in like a place like Texas. There are people from Eritrea, Ethiopia, and also Chinese immigrants and Vietnamese immigrants. So it was a very diverse group of all women, but they were all low income, low skilled women who had jobs that paid hourly.
So I want to look at the banner below you, because I think it speaks to what you're saying. So each dollar that we invest in family planning saves $7 in future public spending. So if you say to that woman, I'm not going to give you contraception, I'm not going to pay for your abortion, you're just going to be, you, the taxpayer, like, let's take beautiful, wonderful human emotion out of it and just talk to politicians where it hurts, like right in their wallet. You are going to spend more taking care of that woman and that child later.
She doesn't get any more money for having the child. So, this man, she's having all these children because she gets
more money.
Yeah. You're like, no, she doesn't.
Even if she does, it's not sensible spending. If you just think of finances, it costs Medicaid $13,000 to do labor and delivery for a Medicare patient. So on day one of that baby being born, Medicaid now has spent $13,000 already.
Wow.
So you're already $13,000 in the hole. That's a lot of birth control pills for
There's a
$13,000.
lot of birth control
A
pills.
lot of IUDs you can
Yep.
place for $13,000.
Exactly. Exactly. And I worry about those women, to be honest. I worry about their access. They already are just keeping their heads above water. And now we are infringing on them even more and saying, here, now carry more. And, the whole idea of like, oh, just give them up for adoption, or, we have other plans. They can just drop them off. We'll have a drop off program. And it's just like,
yeah, that's after the fact. That's like saying, let the bugs all in the house and then we
yeah, and
can
then
always
kill
step on them and swat them. It's like
once they get there.
prevention. So I don't know, I'm sure Pathfinder has now thought of 100 initiatives they're doing. And
Yeah.
I'm just the founder of a small GYN practice in Princeton, New Jersey. But our website's princetongyn.com. So that's why the banner will say Princeton GYN. But Women's Healthcare of Princeton, we are going to have something called IUD Day, because I don't know why, every year when it's D-Day, because I've spent almost 30 years in GYN, I always think IUD Day. So we're going to host an IUD Day to get women the long-acting contraception they need, because it is hard to come back and get those pills. And if even states like New Jersey won't pass a silly law that allows women to get the birth control pill, maybe we can try to get what they call LARCs, long-acting reversible contraceptives. I know you know what it is. It's for our listeners, LARCs. So if you remember nothing else, remember LARC, LARC. That's what you want to go in and ask your clinician for, because an IUD or a shot or a Nexplanon implant, you can put it in and forget about it for quite a while. So it's cost effective and it's easy. And in countries, and you know this already, of course, Crystal, where LARCs are employed, the proportion of IUD use in a country is proportional to that country's GDP.
Yeah.
So we know that if you can get women reliable, long-acting contraception, they can go toward their families, they can advance their careers, and they can contribute to that community in an effective way.
And we know that. I mean, we know it works. That's the thing. It's like, we know it works. We've seen the impact, and I see it. So presidents of countries, governors of states, they want to, let's get us back to work. Well, women can't do that if they're having a pregnancy every year. It just
maybe when they sent the COVID checks, they should have put an IUD in every COVID check. For the women that take this to your clinician. I think that's one of the best ways you can get a community up and running and buzzing again, is to, and it's not that I don't want women to be pregnant and have all the children they want, but I want them to do it when it's right for them.
Absolutely.
I just hate seeing that we're going backwards. So I don't know. I don't want to go on and on. I feel like you and I could go on. And the show in theory is 30 minutes, but when we get topics like this, we tend to run over, because sometimes people have questions. Sometimes listeners have questions. What else, Crystal, what else would you want to cover? What else haven't we?
I think the other thing is about women's representation and leadership. We talked about, you mentioned that you testified today, and all I keep thinking about is, we need women to run for office. We need them to be on school boards, county boards, all those things. We need that diversity of voices, because it starts there. Clearly, the anti-choice groups have started at schools to take out, sex education in schools, and age-appropriate sex education. No one is saying give a 5-year-old the same information as an 18-year-old. Age-appropriate sex education. We've taken it out of schools. We've decreased access. We don't have nurses who say, wait a second, hey, It looks like I've seen her in the hallway. Now it looks like she's getting bigger and bigger here. Let me talk to her. Or I remember nurses looking around and seeing, bodies changing and saying, let me come talk to you a little bit. What's going on? Let me communicate with you. And being able to tell parents, hey, we see some body changes here. Have you noticed? Because they were in the schools walking around. These positions are important, and they start in our local communities. And we know that women are not running for office as much as we need them to. We know that we are still having men, usually white men, who are over 60, making decisions about women's bodies. And it doesn't matter. It's at every level of the elected officials. And this has got to stop. It really is. We have to, and everyone doesn't have to run for Congress, but these local positions are really important. And women are always doing the work. We need to get elected to really get credit for the work and to change the laws and change the policies that exist in our communities. So Ms. Magazine has this whole thing about representation, and it really hit me hard that one of the biggest problems we have is we don't have enough pro-choice people in Congress. That's what it really comes down to. Mm-hmm. We don't have enough to say, this is a ridiculous conversation to keep having over and over again. We settled this law, move on. And, instead of reversing healthcare for women, let's increase access to healthcare for women and make sure it's quality and make sure all women are getting it at every level and whenever they need it. All people, to be perfectly honest. Let's make sure that children are getting healthcare that we bring into this world. And I just think we just have to, focus our efforts and really vote in the midterms. I love that. It's so important. And vote in every local election. Local is so important. We have to really pay attention. That is what's going to change our lives, to be perfectly honest. Change it for the better.
But when you look even at the opposite of that, the top echelons, right? And I look at other countries, it's how I feel about Mozambique and Mexico and Argentina. I think if they can do it, why can't we? Yep. If Pakistan, right? Pakistan has a female prime minister. Yeah. I feel like there's something in our society that is still very, very hung up on the image of a powerful leader as a white male. And my focus of interest is on female sexual function. So I'm a board certified OBGYN. I don't do OB anymore. And within gynecology, I focus on menopause and I focus on sexual function. And a lot of the talks I give talk about an androcentric model of sexuality, where it's really about male pleasure. That's what sex is really for. That's why Viagra, was such an important medication and was rushed through the FDA and is a
praised all over the place.
Praise God for Viagra, and there are 30 Viagra knockoffs. But I feel like there's an androcentric model of politics too, where even though they've let some women in, it's like, phew, now we got diversity and inclusion taken care of. Oh, look, some are women of color. Oh, some have headscarves. Okay, we're fine. And it's like, I don't know about that. I don't know that that's enough. I feel like it's enough when the laws reflect all of us, not just when some of us are sitting in the chambers. The laws have to reflect what people need, not just wealthy whites need, but all people need. And I thought of that as I was driving away from the Senate today. And I just thought, I hope these people can think about their constituents and not just their own career. But gosh, it's so hard not to get political when you talk about this. It really is.
Well, we're getting political because they made it political. It's like if we stop discussing women's bodies and focus on other things, it would be wonderful. Like, the conversations I want with my healthcare providers, not with, lawmakers, to be perfectly honest. And that's basically all women are saying. This is a decision with me and my family, not your decision.
Yeah.
Pretty basic.
I think another interesting concept is cost, though, and the cost of contraception and the cost of an abortion. The cost of a birth control pill pack is anywhere from $5 to $500, and you know how crazy our healthcare system is. The cost of an IUD, what is the cost of an IUD if you go to Planned Parenthood today? I don't know.
Oh, and then they do sliding scales. So,
They
it could,
do.
yeah, you can do you probably free this office visit up until like $100 or something, or 200
Mhm.
bucks.
Yeah, yeah, and while I would say, "Gee, that's dirt cheap for 6 years of contraception, 6 divided by 100, right?
Yeah,
12, 15 something,
still,
I'm not good at math,
yeah,
but but yet, there are not a lot of people who are not a lot, there for many people, saving that $100 is a lot. It's deciding between paying for their kids' appointment, or their food or something. And so it's really frustrating to me when I meet people from other countries who say, in my country, women's health care is just better covered. Things are free. IUDs are free. Birth control is free. And it's assumed that we can all get it. And like in France, even after a vaginal delivery,
yeah,
France pays for pelvic floor physical therapy to rehabilitate the pelvic floor muscles. This is
amazing.
luxury in this country. That is never covered in this country. And
It's amazing what they cover. They cover health for the mother after to support her mental health, to make sure she's in the best case, lactation coaches and all that. And it's but because they're really truly pro child, pro woman, as
Mhm,
opposed to being pro fetus.
mhm,
And that's what I say to my friends all the time. I'm like, you know, and if we really were pro family, pro child, the way we claim to be, and make that the issue, then we would take care after they got here, and we would only, ensure that anyone who wants to get pregnant can get pregnant and support them throughout. And those who choose not to, that be okay too. Like,
mhm,
novel concept. Everyone does not want to be a parent. And that is
mhm,
okay. They shouldn't be shamed for it or anything else. And I think it is interesting. Or they want to space their children. Like, we know that, spacing children is better on the mom, it's better for the children. But we kind of like go against like basic knowledge. And it's like, like with COVID, it's like we're going against science.
mhm,
Science says healthy timing and spacing. That's what
mhm.
makes sense for women's bodies to recover, and for her to be able to give her time and energy and her family to her child with breastfeeding, all these other things. And so, why force another pregnancy and say, well, yep, you messed up. Well, you're married. Just go ahead and have the other kid. You're like, that doesn't make good economic sense, like you said. And it
Yeah.
doesn't make good, mental health. I mean, all you're doing is stressing the woman and the family.
Crystal, I have a question just to pivot a sec to
Yeah.
college campuses and college kids, because college kids have oopses.
Yep.
Um, What I mean, does Pathfinder ever work with colleges for educational purposes or anything like
Well,
that?
we
Or I
have
know you
a
guys can't do everything,
yeah.
but or if not, do you have suggestions for if for women listening who are in college or grad school who either are struggling to find access to contraception, or to what would you advise them if they have an unintended pregnancy and they're especially if they're in a state where it's hard to find access? What could
Yeah,
they
I
do?
definitely think, thank goodness that, we jumped into action. We being the global health and reproductive health community, we believe the United States is part of this globe, and we support United States behavior just like everyone else, even though we don't do work specifically in the country. But some of the services that we said, some of the websites where Planned Parenthood has a list of them, where women can go. Ms. Magazine has a list of them, where you can go and say, I live in this state, here's the closest place to get, and you have phone
Good.
access to call and be able to find out if medical abortions are available in your area. And what I do worry about those young women, we've both been young, and we realize is that, you never want them to make a decision that could take their life. And you don't want them to be so scared about a decision. I'm in college. I had an oops. Now what? So I remember being in college and talking about Plan B, and saying, like, if you have, condom break, all these things, your RA in the dorm has access to Plan B, to emergency contraception, to ensure that help you so you don't have a child or don't get pregnant, actually. And then that's before. And if you get pregnant, here's access to abortion services or adoption services. Or if you want to have a child, here's what you need to do to put that in place. They gave us all the options times three, which they would call it. They give you all your options, but it was a really good emphasis on condom usage, and then Plan B as a backup. And I grew up with that in my head. Didn't make me want to go out and have sex more or less. It made me responsible in understanding what would happen if something happened to me or I was in a situation, something changed. The other thing is, sadly, we know sexual assault on college campus is high, especially when alcohol and drugs are involved. And we know, imagine that, it happens on college campuses or around in college towns. I went to a very large university in a college town, and we know it happened.
Yeah.
A
Yeah.
lot
I
of
think
young
it's
people,
underreported.
it's
I think it's, sorry to
underreported.
interrupt, but 24% of women in a recent national survey admitted to being sexually assaulted. Now that's a
And
general term, and some
yeah,
of them were just, it was very mild, but
we know that's underreported. That we know
it
that.
ranged from unwanted kissing to rape, to
Yeah,
violent rape. So if 1 in 4 women is experiencing this or is reporting this,
reporting
it's
it. Yeah,
quite common. So I think this is a particularly at-risk sector
yeah.
of women who need contraception, who need not to be relying on condoms, because then that means they're relying on
Well,
men.
the male. Yep,
Um,
yep.
and that's not a particularly reliable cohort of men anyway.
And we know
So
that they could get pregnant from this sexual assault. We know
yeah.
that there are laws on the books, coming on the books, ready to go on the books to say that victims of sexual assault, if they end up having a pregnancy, the families of the rapist families can sue for custody, sue for access to the child if
Oh
they
my
choose
God.
to deliver the child. So it's like one of those things is like, you want to talk about scary things and bad movies. This is happening now. And
Yeah.
that's why we have to. I don't believe in my heart that there's any woman who looks at a law like that and says, a rapist. They actually say the rapist should have access to their child.
They don't wanna ever have anything to do with their rapist again. It's hard to fathom. Well, I wanna just post something real quick
Yeah.
about, something called Fexi, Phexxi. I'm not supposed to use brand names or whatever, but, Fexi is a gel, and it's on-demand birth control for women. And why is that important? Because if you don't have access to anything, if you run out of your pills, if you are too scared to get an IUD, if you can get it's by
This is a new
prescription.
one for me. I hadn't heard of this. Sounds amazing.
If it's by prescription now, I think, because they have to make up their research and development money. But in my dreams, it's going to be over the counter someday. It's a all natural kind of ingredients gel that is anti STD and anti pregnancy. It kills sperm, and it's being investigated to see. It looks like it kills STDs. So it's something that
Wow.
women can insert this gel vaginally up to an hour before they have intercourse. So not talking about rape or sexual assault now, just talking about whether it's hookup culture or a monogamous relationship or whatever. But women who don't have the pill or IUD or access to go get a Depo-Provera shot, they can get a prescription for Fexi, and it's just, they look like little tampons, and it's filled with this gel that it's 93% effective. So not as effective as some, but
Yeah.
a whole lot better than nothing. And I like the fact that it's women who control it. So in a way,
Yeah.
it's almost our version of a condom. If
Yeah.
we want to be responsible and we have this Fexi and we can insert it, then at least we are choosing to protect ourselves. And I can't wait for the further research results to see if maybe it even cuts down on STDs. That would be two
Love
for
that.
one.
Yeah.
But I
Yeah.
thought kind of good for people to know about it. Some
Yeah.
women have problems with a pill and then they say, "Oh, I don't want to be on the pill ever again." I also beg you to try a different pill or a
Yes.
different,
Yeah.
try it again, because many pills are lower dose now, and there's many different types. And I had identical twins that came to see me once, and I put them on the same pill. Why not? One, it was perfect, and the other had every side effect in the book. So we don't know as clinician what's the best pill for you,
Yeah.
but we are certainly willing to keep trying. So just because you had unpleasant experience or weight gain or acne or something with the pill, I would not at all say that goes for all pills. And I would say, go back to your clinician, try something else, and do ask about Fexi, because boy, if it were up to me, we'd mail a pack of it to every college freshman and say, just keep it in your top drawer so
Just
that
in case.
yeah, you don't want to be waiting around hoping your partner remembered condoms or is not using his older brother's old one or whatever, I mean, it's just too important. It's too important.
Absolutely.
I think we
Absolutely.
have a question. Someone, one of the, I thought we had a question. I'm just going to wait for it to pop up and see,
Yeah.
but we'll see if Olivia pulls that up. Okay, from Sam Rutherford. Do you think women getting out and protesting will affect change? Oh gosh, Sam. Huh. That's a
It's
good,
I think it's a twofer. I
yeah.
think one is we need decision makers to understand that there are people behind those numbers. So that's what basically the protests are. They're real people. I will tell you, someone who worked with members of Congress regularly, they said, well, we didn't hear from anybody, so nobody really cared. So they think they can make decisions that no one knows about. By calling, I would say more than protesting, calling, emailing, tweeting your member of Congress and letting them know how you feel, especially when you live in their district or their state. Letting them know, say, I want you to know this is my story, and I want you to know this is why I support. This is where our male supporters and allies can really help on all this, and say, I've been there with my partner. I went with her to get an abortion, or hell, I just believe in abortion, and it's
Yeah.
none of your business. I think more of us need to do that, because what happens is they do hear from the other side. And I will be honest, they hear from them a lot. And the protest, sometimes people are like, well, what is protest going to do? Well, every year the Right to Life does their parade on Roe anniversary, and they do it every year because they think it shows solidarity, and it's a picture. And then you see all these people and you're like, ooh, I don't want them yelling at me. Now we know that they take Catholic schools and they just dump them there and keep them going. The kids don't even know why they're there, but they know that is the visual that matters. And we know that, frankly, in this very social media society, those visuals matter.
Right. So not tomorrow's Friday, Saturday morning in Washington is a march from the state capitol to the Supreme Court, just a peaceful march. And I'll be there with my son and his girlfriend. And I think the point is exactly as you said, just to show solidarity and show that there are not a small number of women and men in this country who believe a woman's right to choose is her right.
That's right.
So
I think I cannot emphasize enough making sure your elected officials hear from you. It is important. Tweet at them constantly on social media, call them, write them. It really does matter. One call, they're saying, oh, wait, goodness, 10, 15 calls in a day saying, I am disappointed in your vote. We just had the Senate vote today to codify Roe, and we know that, the West Virginia senator did not vote the way he should have, to be perfectly honest. And a number of other, pro-choice, I shouldn't say, number of other Republican senators did not vote in a way for women's rights and human rights. Women in those states should be calling up and saying, do you think I don't know enough to make a decision about my body? And if I'm in a partner relationship with my partner, like, this is our decision that we should be making, not you. And they need to hear from you. I think, frankly, they think that you are not paying attention or you don't care. And that's why they think they can keep doing it.
That's right. And I know in New Jersey, the chairman of the Health Services Committee is Senator Vitale. So I'll see if we can post here his name, so that, and maybe even a contact email. So it'll be easy peasy for listeners from New Jersey to do that. And Crystal, I bet you'll do that for your district too.
Yeah,
I think we
absolutely.
each just take our own little chunk. That'll be helpful. So we've got some really cool topics coming up on gynecology, but I think I know we're going to do another session related to this. I have a bunch of people who've now contacted me, who are, whether it's from a legal perspective or human rights perspective, or political, advocates and activists who would like to have some airtime to share their thoughts. Crystal Lander, I can't thank you enough. You've been articulate, eloquent, passionate, and it's obvious to me that you care an awful lot about helping women literally all over the world. Crystal, I wanted to make sure you know, do you know what the girl effect is? The girl
I
effect?
I don't.
Oh, this you must look up. It's called The Girl Effect.
Okay.
The website is thegirleffect.org. I dream of getting on their board. They empower women in mostly in African countries, but they're spreading into the Middle East. They empower young women, adolescent women through social media to be educated about their life choices, but
Yeah.
mostly about their reproductive health rights and options and opportunities. And the new, the first uh, chairman was Maria Idle, who founded the Nike Foundation, who's an amazing
Oh,
woman. The
yeah.
new chairman is Jessica Odede, and she and her husband, who grew up in a ghetto in Africa, co-wrote this book about bringing people out of poverty in an African ghetto. And her name again is Jessica Odede. We'll post that. This
Yeah.
is a woman to watch. This is an amazing woman.
Okay.
She was a upper middle class white woman from Colorado who went to Africa just for a study abroad. Couldn't have been more clueless, she admits, and she was so stunned by the need to help all people, but they help young women to really get themselves out of poverty and get educated. And one of their main thrusts is by getting reproductive choice in the hands of these women. So check out The Girl Effect. Their book,
Love
by
it.
the way, I've got to post this, is called Find Me Unafraid. If you need a book group suggestion or you just want to read something really cool, Crystal, you would love this, I am
Yeah.
sure.
I'm so excited about this.
Yeah, Find Me Unafraid. It's an easy read. You'll feel like you want to run out and save the world, or you'll just feel in awe of Jessica Odede and her husband. Um, but honestly, Crystal, it's been great having you. To me, you're one of them. You're one of these people that's just giving and giving for the
Oh,
betterment of
yeah.
others. So
I am it's been a pleasure, and I just encourage everyone who's listening to get involved, show up, encourage others, tweet your member of Congress, let them know, even if they're on our side, let them know that you're paying attention, thank them for standing up for women's health and rights. And if they're not on our side, make sure you tell them that you disagree. They need both sides needs to hear from us often. So not just today, every day.
true, true. There's a statistic that Olivia and Sam have put up that half of the people who can become pregnant in America live in states that can quickly move to ban abortion if the Supreme Court overturns Roe v. Wade.
Yeah.
That's an awful lot of women who are going to be going without. That's an awful lot of women that often can't leave their state. I mean, I've people say to me, look, they can just move. You can't just move. You may be caring for an older parent. You may have a disabled child. You may have a job.
Yeah, how about you have a job? Start with
Yeah,
that.
I know. So I kind of, I don't even know how to answer people who say, well, just have all the women move to different states. I just don't
A
really
level of privilege that you just can't even
I
think.
don't know how to answer that, but it's a big problem, and we hope that I hope that you and I can talk again and have
Absolutely.
made some progress. But please, thank you so much for your
Thank
time,
you.
and we'll look forward to seeing you again. Take care, Crystal. Good night, everybody. Thank you.